Thought leaders participating in this program are speaking on behalf of Lilly. They are compensated for their time and expertise. Any opinions expressed in this podcast reflect their clinical experience and expertise. Welcome to Neurizons, the podcast where we hit the road to explore Alzheimer's disease and the goal of maintaining brain health, one conversation at a time. I'm Bert Vargas. I've been a neurologist for over 20 years, and now I'm cruising across the country, chatting with some of the brightest minds in the fight against Alzheimer's disease. No formalities, just honest conversations with thought leaders, innovators, and advocates, all aiming to crack the code on preserving cognitive health. In this episode, I'm joined by Dr. Kavita Nair, a brilliant researcher and professor in the Department of Neurology at the University of Colorado. Kavita spent the last decade digging into how we treat neurological diseases. Join us as we discuss risk factors for Alzheimer's disease and dementia, including those that are actually modifiable. And she offers up some eye-opening insights. We also talk about how and when to start those conversations with patients and why it's never too early to think about brain health. Welcome to Neurizons. Hop in and let's talk.
Kavita, I feel like I've gotten to know you over the last several years, mostly through, neurology circles, and it's a pretty tight community. It's a small community, but I'm not sure I've really ever gotten a chance to really get to know you and kind of know a little bit more about you and your background. And I just have to ask, just from the beginning, tell me about your childhood. Where did you grow up?
Well, that's interesting. I'm glad you said that, because I do have I'm a little bit of a unicorn in the neurology world. And why don't we start at the beginning?
Yeah.
Right. So I was born in India, Kerala, the southernmost tip. Beautiful beaches, and then I spent the first 8 to 9 years of my life in India, and then my family went to Africa. My dad got a job there, and then after that, I went back and finished my schooling in a boarding school in India, and then did my undergrad in India while my parents lived outside the country in the Middle East for several years. And I came to the U.S. about 35 years ago to go to grad school, and so about 28 years ago, I landed at the University of Colorado, and my background is really in outcomes research. They call it all kinds of things these days, but we were the OG. Here I am with Alzheimer's, and I have a personal connection to that as well.
So tell me about your dad, and what kind of work did he do, and what brought you to Africa?
Right. Dad was one of the first 6 engineers way back. Think of India, you think of engineers and IT. So way back over 60 years ago, IBM came and trained about 6 engineers, and Dad was in the first batch. And so subsequently, when I came to the US and got a master's degree and then a PhD and came into an academic position, he was the one that understood the value of it and recognized it. And then when he got struck with Alzheimer's, he was back in India at that point, and it sort of I saw it, rob him of his dignity. That was when it got very personal.
That's interesting. I didn't realize that you had such a personal experience with Alzheimer's disease.
Yes, yeah.
Tell me more about that.
He lived in India, and my mother was taking care of him. And I, as an immigrant, that's always one of the struggles you deal with. You have aging parents, we're the Gen X generation that have kids to raise and then have aging parents, and we live 10,000 miles apart. And so I would go and see him every year, and every year, there was less of him. And then he passed away about 3 years ago. And you start wondering about your own mortality.
Tell me about what your mother was going through as he was experiencing that decline. How did she handle that?
She was an excellent caregiver. And living in India, you do have a lot more caregiver support, just the system of Asia. But she was there by his side. In fact, she was there with him when he died. So he didn't die alone by himself. She took care of him, and she did it with grace and willingness and just with a smile on her face. But following that and following his death, her health declined, and then walking her through the trauma. I think many families, we just don't get a chance to talk about it after the fact.
How many siblings do you have?
I have one sister.
How did she deal with that?
I think she's still dealing with it. Yeah. For me, it was, I think partly because when you're in the clinical space,
right,
you understand death and disease and death. I think for her, it's still something she struggles with.
Was she wrestling with this because sometimes death is just a very heavy, uncomfortable subject for people, or was it she began to worry about what her destiny was going to be from an Alzheimer's perspective?
Yeah.
Wondering if the family history was going to be revisited again in her own, sort of in her own medical history.
Some of it, yes. My father had a sister, my aunt, who also passed away from Alzheimer's. And he had another brother. So there's a pretty strong family history.
Yeah.
Dad's passing was, it was a release. Mm-hmm. Peaceful. It was the right time to go.
Right.
It absolutely was. But it has awakened in all of us. And then we have cousins who are, everyone's like, should we get ApoE4 testing? What does that mean? And I've been very cautious today. If you're getting the testing, make sure you have a genetic counselor talking to you. So I think there's just that feeling of, this will happen to us as well. We will encounter death. Mm-hmm. And it could be through this incredibly devastating disease.
It sounds like you've considered checking your own status. I guess what has kept you from doing that?
Quite frankly, it was just at one point I was going to do it with these at-home tests. Mm-hmm. And then I felt a little nervous about where my data might go, because I do think it's important to know, at the age I'm at, what my risk factors are headed towards potentially having dementia, and to see things I can do to modify, to help myself, prepare myself.
And I feel like there's so many things that can change, environmental factors, choices that we make about our own lifestyle that can influence how that biology plays out.
Yeah.
So maybe that's where that role of the genetic counselor that you talked about comes into play.
Yeah.
Is that why you think a genetic counselor is so important and part of that ApoE discussion?
Yes, I'll answer this in a couple of ways. One, I do think the discussion about your ApoE status isn't best had through an at-home test, because of the fear and ramifications. And there was a celebrity a few years ago, and forgive me for spacing out on his name, who took the ApoE4 test, tested E4 homozygous, and then, said he was going to make big dietary changes. And it sent some waves, because again, when a celebrity does this, we're in pop culture. I appreciated the fact that he is a young man. His doing this shed light onto it. But I think we need to be careful as to how this information and who does it. So a genetic counselor, a primary care physician, folks that you're going to see for your overall health. I don't think it's early enough, or should never be early enough, to have those discussions, as opposed to when you're at a point you're seeing a neurologist and there are symptoms.
Right.
So, I'm sitting here not showing symptoms, at least I don't think so. And the discussion should be happening now with my primary caregiver or my whoever I'm seeing, so that if I am homozygous positive, I can look at other factors to try and mitigate my risk, and not the conversation that needs to be happening when I'm symptomatic and when I'm at a different stage and could have prevented or at least mitigated my risk. We shouldn't be so afraid to talk about dementia, risk factors, just like we talk about cardiovascular risk, we talk about hypertension. Why don't we tie this hand in hand? What is so scary, or what is so difficult to talk about brain health?
Yeah.
For as long as I can remember, in India, everyone wakes up really early. There's no concept of sleeping in, because you have the vegetable person coming to the house, the person who comes and collects your clothes, the roosters, the cows. And I'm not kidding. It's one of my most familiar sounds of India. And everyone goes for a walk. So heart healthy or cardiovascular health in terms of a walk is very common. I think where, in terms of maintaining preserving health, preserving cardiovascular risk and preserving brain health, we could do a lot more, and sort of modifying some of those factors to mitigate some of the high rates we're seeing of cardiovascular risk, which also correlates with brain health. I think we could do more in that regard.
Yeah.
And again, brain health as opposed to this will prevent dementia. Dementia is one aspect on the continuum of everything with brain health. And so if we can start identifying and having conversations with our patients, with our communities, with our family members. Listen, so the cardiology world has done a really great job of saying, eat healthy, exercise, 30 minutes a day, take 10,000 steps. Why not tie in brain health to that? Mm-hmm. Because is one more important than the other?
Right.
Or which is more important?
Yeah.
Right. Have the conversations simultaneously as opposed to you only see a neurologist when something is wrong.
When you talk about having those conversations, I mean, is there really a right time to start the conversation, or really is the conversation a reasonable thing to do at any point in someone's life?
Have the conversation. It's not reinventing a framework that already exists.
Right.
You're adding to it. Not only is your cardiovascular risk at stake, but your brain health, your health for being cognitively. That's going to get people's attention, and it's correct.
Right.
And it doesn't then become, I'll go see a neurologist when I need it. And these can be conversations that we incorporate. We train our colleagues in primary care. Make this part of the conversation. Why not?
Yeah, no, I think that makes perfect sense to normalize the conversation.
Yes, I love that word.
Right. What are some of the barriers? What's holding us back from really, immersing ourselves into that kind of ideology?
The part that always is the least interesting and the least attractive, or the things that no one wants to talk about, is how is this going to be sustainable? How are we going to incorporate it? Our payer is going to be like a brain health visit. What's that all about?
Right.
Right? So the concept is there. We do need to operationalize this concept. And what's that going to look like? And so that's a very fair question. And it's going to have to do with coming together, putting some thought to it, partnering with other professional organizations, and then ultimately, for this to be sustainable, there's got to be some billing and coding.
What are some measures you've taken for yourself? And actually, it sounds like you already live a lot of really healthy lifestyles. But are all those things that you have done part of an intentional shift at trying to incorporate brain healthy behaviors, or is that just what you've always done?
I wake up early just because aging.
Right.
And then I use that time very intentionally to say I have one life to live. I have this family history, non-modifiable factors, but it is in my control at this point in time. And so I have type 2 diabetes. I have to manage that. So to stay as healthy as I can, because coming down the pipeline, potentially for me, is this devastating disease.
Yeah. I when I'm thinking through some of the other risk factors,
yeah,
I think of some of the socioeconomic contributors to dementia. And I know there seems to be some research indicating that socioeconomic status also has a big impact on someone's risk for dementia.
Yeah.
What are your thoughts on that?
We've heard the term, I'm sure, social determinants of health. And it's a lovely term to use, and it sounds very noble. But it has real life consequences. So you're looking at factors through, a child born into a certain home is a child born into that home and already may have some factors that are strikes against that innocent child because of their circumstance. Not able to finish high school, not able to finish college, not able to have education. That really has a snowballing effect. The more educated you are, it helps build up your cognitive reserve, right? We'll see if that holds up for a few of us when our time comes. So just even having a level of education has a neuroprotective effect.
Right.
or being able to attend plays and operas, activities that we need to think about that as we start assessing their risk and understanding and helping communities.
Again, going back to your father, highly educated engineer.
Yeah.
And when we talk about cognitive reserve, I imagine he had built up tons of cognitive reserve. I'm curious to know, were you and your mother and other family able to detect maybe a little bit of a decline before it got to a point where others could necessarily detect that he was having a problem?
I think I was.
Yeah.
He and I were very close, and we would talk about politics, every country. Like he would know. I think I started noticing that decline, and I've reflected on this tremendously, maybe 10, 15 years before just because he and I would talk about the detail of this election and that election and, the nuances. And he was otherwise a very, my mom is the extroverted. I have her personality, and Dad was more, but he and I would talk. And I started noticing signs. And again, the Indian culture was, oh, he's fine. He's just tired. Mm-hmm. And then his symptoms progressed, and, it is what it is.
Right.
But I started noticing probably 10, 15 years that something, and we don't know now then what we know now.
Let me actually take a step back and say, I see sometimes people kind of going back and forth between brain health and cognitive health.
Yeah.
And first of all, are they the same?
Cognitive health is part of the family of brain health, right?
Right.
Brain health is I think, my interpretation, overarching umbrella under which cognitive health is part of, underneath that umbrella.
Gotcha.
Yeah.
And as part of assessment of cognitive health, I imagine there's some benefit in kind of knowing where someone stands at their baseline, right? What their baseline level of functioning is. And I keep going back to your father, but he's such a really interesting part of this story. You were saying before that he had built this cognitive reserve, and you were able to detect some changes before everybody else was able to detect them, just because he was so high functioning. Had he had a mechanism to establish a baseline to compare against, do you think his condition might have been caught earlier?
I really like this question. When we think about the preventative screenings we do, colon cancer, breast cancer, prostate cancer, we do it proactively, or the guidelines suggest they have to be done proactively. Right? Based on evidence. And then based on your risk factors and age being one of them, your frequency of doing it after that varies. Right? And those are, melded into our psyche or our healthcare system. If we think of cognitive health and brain health in a similar fashion, it makes sense.
Yeah.
The devil will always be in the details. How do you assess cognitive health?
Right.
Which instrument do you use? Who does it?
Right.
So,
like I said, I've known you for some time, and I don't think I've had the chance ever to really dig into who you are, your history, your background. This has really been fantastic. I'm torn right now because I unfortunately have to get going, but I feel like there's so much more to know about you and your thoughts on this topic. But thank you so much for joining me today.
Thank you, Bert. This is a journey that we need to take collectively, as professionals, as researchers, as developers, to the next level, because we don't want our children, and I'm so lucky I got to meet your beautiful twins.
Thank you.
To bear the burden of this. So there's a collective responsibility for all of us to keep working and moving in this direction. And this has been so much fun. I got to interview you now and find out. It's an excellent interview, but thank you so much. This has been it's been very healing as well to talk about some of these things.
Awesome. Thank you so much.
Cheers.
Cheers.